Hello, good afternoon, everyone. Here we are with us with our another Facebook live session, and today our Facebook live session is really interesting, and that is bed rest and IVF. The IVF journey, as we all know, that it is a stressful journey because lots of family stress, economical stress is there, and this journey is totally new for us. This whole procedure is new for the couple, the family actually, who is going through this. It is a new procedure. We are actually extra precautious, and because we are extra precautious, we think that bed rest is very much needed as any other operation. Like if at all you go undergo any laparoscopic surgery or any abdominal surgeries, then some bed rest is advised for that according to operation, of course. IVF, also we think that the bed rest will be required, but actually in this session we are going to talk about this only, that is it required, is it actually required, is it beneficial, or is it not. So firstly we will think about when your procedure start, like when the stimulation start, when we from the second day of your cycle we start your injections. So when we start you with the IVF journey or the IVF stimulation, we say as, so at that time actually the you can continue your daily routine. If you are working lady, you can work, you can come for the scan, you can take the injections, you can go whenever your blood tests are there, you can do your blood test. And of course you can work. If you're a homemaker, you can do your daily chores. So this is about stimulation. Then at on the day of ovum pickup or oocyte retrieval, that day you need to take the off, because that day you have to come nil by mouth, then you will be anesthetized, and that short procedure of half an hour of ovum pickup will take place, and you can go home on that day only. That is a daycare procedure. And yes, on that day, because you were given anesthesia and you have a little sedation effect, that day you need a rest for that day. But of course it is for that single day. Now coming to the next procedure, that is a very important procedure, and most of the questions are revolving around this only, that whether the bed rest is needed after embryo transfer, before embryo transfer. Before embryo transfer, of course, there are some scannings where we see for the endometrial thickness. That is, we see whether the endometrium or the uterus is well prepared for embryo transfer. So now, on the day of embryo transfer, the anxiety is at the peak. We all, it is actually human tendency, because it is last or the final step of your IVF journey. But we can relieve, or we can overcome this anxiety. We can keep ourselves calm, and if at all we are well informed about this procedure, that it is not going to be under anesthesia, it is just a procedure, a 5 to 10 minutes procedure like a IUI. And what all we need to have a precautions, like we need to have a full bladder. Then for that we need to drink water, and also we need to not use any cosmetic on the day of embryo transfer. So all these minor informations, if you are well versed, and how the procedure is going to happen, if you are well versed with, then it will alleviate your 50% of the anxiety. Now coming to embryo transfer, as I told, though it is a last and optimal step, but it takes only 5 minutes. Now after embryo transfer, there are many studies. There are a number of studies which have included more than 60,000 of the patients who have undergone IVF. Now in these patients, what happens? They have studied that who have taken bed rest for 1 hour, like half an hour after embryo transfer, and who have not taken embryo transfer bed rest after embryo transfers. Now it is seen that the patients who have taken bed rest, the success rate has actually reduced. So it is advisable that immediately after embryo transfer, only 10 minutes of bed rest is required, and after that you can you can walk around, or can the complete bed rest will actually deteriorate the success. It will actually reduce the success, and not by 1 or 2%. It is like the studies have shown that it has reduced up to 13%. So this is also very important thing. Now coming to After you have embryo transfer is done, now you're going home. After that also many of our patients have questions like, ma'am, now can I go back to my office work, or should I rest at home? For the working ladies and who are homemakers, that they have questions like, can I do my daily chores, can we do our daily routine, or we should just take a bed rest? So dear friends, from this Facebook live, I will like to tell that actually if the complete bed rest is going to deteriorate the success rate and not in going to increase the success rate, so it is going to deteriorate the success rate by 13 to 15%. So what to do in this case? So in this case, actually you 7 to 8 hours of sleep is enough. If at all you think that the your walking or daily routine activity is going to hamper the success rate of your IVF, that is not at all like that. So you can do your daily routine activity. If you are working, you can do your whatever the schedule is there of your work, you can definitely do that. Only thing is, some of the any strenuous activities like lifting heavy weights or all, this should be avoided. Any strenuous activities which is going to increase your abdominal intra-abdominal pressure, like any lifting heavy weights or any vigorous activities, that needs to be avoided. Now 7 to 8 of 8 hours of sleep, proper meditation, taking your medications, the post embryo transfer medications, taking them on time, whatever injections that has been suggested to you, taking them on time and following your routine, taking plenty of water, proper diet. And in diet also, many of the patients have very much questions like what should be avoided, what not to be avoided. So routine diet is actually advised. Of this protein rich diet, folic acid rich diet, folic acid in the form of fresh fruits, vegetables, sprouts, this folic acid rich diet, protein rich diet is advisable. Then so diet related restrictions are not also very much that this particular diet is to be followed after embryo transfer. It is not like that. Now coming to some queries like the usually that we come across, like climbing stairs. If at all you are climbing stairs, it is so embryo which has gone inside the uterus, it is going to be like a oyster in a pearl. So sorry, pearl in a oyster. So it is going to be there, and your activity is not going to make it move. So this procedure is very safe procedure. And if at all you are climbing stairs, that is also okay. When you are using a two-wheeler, four-wheeler, so most of the patient use that, can we use four-wheeler, or we need to use only four-wheeler, or we can use two-wheeler. So you can use two-wheeler also. Then coming to whether you can use toilets, like we can use Indian toilets, or we have to use commode only. So you can, whatever, squatting is also okay. You can, after embryo transfer also, you can sit, squat. So that is also not going to hamper. So these are very basic questions, but these are practical questions which we come across and which we actually routinely answer, which I wanted to address also. So climbing stairs is also okay. Then using Indian toilets are also okay. So these are the things which we should follow after embryo transfer. Even after you get your beta hCG positive, this is good that your result have come positive. Now after that also, when you're conceived with IVF, then also the ladies think like that my pregnancy is different from the pregnancy that is that has the lady has conceived naturally. Yes, of course it is different, because for the first 3 months you will need a extra support of progesterone and other medicines. Yes, your pregnancy is different, but yes, you can still it is not that yours is the IVF pregnancy, or so you need to have a complete bed rest, you don't need to move from bed. It is not like that. Once you have pregnant, then the then the pregnancy is going to grow. But yes, of course, if there are some medical indications, like if there is any spotting, bleeding, where actually any movement is going to harm and going to increase the risk of abortion. In those cases only we say that you need to take rest. So unless otherwise told by your gynecologist or your infertility specialist, don't think that it is IVF pregnancy, that means I have to take complete bed rest for 9 months. It is not like that, dear friends. So uh, whenever you are coming across if at all any relative is saying, after somebody is saying that yes, this is like that, IVF pregnancy, then take a complete bed rest. So it is scientifically proven that during your stimulation, also when you are going through injections, when you are during your stimulation, even after your embryo transfer also, or after you get pregnant also, then also during your 9 month journey, it is not necessary to keep a complete bed rest unless it is medically required. So medically, when it is required in first trimester, generally when there is a bleeding or spotting or any other medical problem you are having, for which you have to take rest. Okay, then in the second and third trimester, like in third from third month onwards, if at all anything like if you have given a stitch, cervical encirclement, on that day you need to take rest. Then in the last trimester, if there is a low lying placenta, like in the last 3 months, if your placenta is low lying and there has been a incident of bleeding, there has been a hemorrhage, then in that case also we need to have a we need to think about having a bed rest. So placenta previa is a somewhat alarming situation where the placenta, that is the it is a nourishment providing organ for the fetus. So that has placed low down in your uterus, and that can cause bleeding in your pregnancy period. So in that situation, the bed rest is advised. So these are the particular specific medical conditions where only we advise bed rest in IVF pregnancy. So this is about bed rest. I think I have addressed most of the questions that are routinely asked. And yes, of course, sleep is important. If at all you are very anxious, you are very very much worried about what will be the result, or how is the baby going to do, that anxiety also can make you sleepless. So for that, proper meditation, keeping your morals high, and keeping yourself in the on the positive side, that yes, and keeping yourself hopeful that yes, it is going to work for me, is going to alleviate your anxiety, it is going to decrease your anxiety, and it is going to give you a proper sleep, and going to make you more comfortable during this journey. Yes. And coming to the other things, what you can do, like after embryo transfer, as I told, taking proper medications on time, in taking even leisurely walk, you can do a leisurely walk, 1 kilometer of leisurely walk you can do a yoga pranayam, you can do. And then yoga also, proper with the proper advice, the yoga you can do. And also breathing exercises, these are all you can do. So these are the things which you need to follow during your IVF journey. So this is all from my side. If at all any question answers are there from the viewers, I'll be happy to address them. If at all no questions are there, I think we will end up this session. I hope it was useful for the couples who are undergoing IVF journey or who are planning to go for IVF journey. Because most of the ladies, we have seen that they quit the job and then they think about IVF, going for IVF. But dear friends, it is not at all like this, that you need to quit your job and then you can do IVF. It is nothing like that. You can you can go ahead with your career, and side by side you can go ahead with IVF also. So it is not that you have to sit back and then only you can go for IVF. So I think this video will help you go through your IVF journey more comfortably and more easily. Mm, with this, I would like to end up this Facebook Live session. Thank you.